Good evening. We are thrilled to have you join us tonight for our annual Zoom program. This one is called The Power of Knowledge: How Knowing About Your Genetics Can Save Your Life and the Life of Those That You Love. I'm Sandy Grossman, a board member with Yodeah, an organization whose mission is to educate the Jewish community about hereditary cancer genetic mutations and provide access to affordable clinical grade testing. We're grateful to Berkowitz, Pollack and Brandt for hosting us tonight and to providing technical support, and also to our partnering agencies and synagogues. It's through our combined efforts that we're able to reach and educate so many people, both men and women, about the BRCA mutation, encourage testing, and provide the information needed to make choices to decrease the risk of developing cancer or be able to catch it at its earliest, most treatable stage. Before we begin, I want to share a few Zoom logistics with you. Tonight's webinar is being provided in, sorry, we're technical difficulties. Tonight's program is presented in webinar format and is being recorded. Attendees will be muted throughout the program. However, we want to make sure to provide answers to all of your questions. During the program, you will be able to submit questions by pressing the Q&A button on the bottom of your Zoom screen. We'll get to as many as possible at the end of the program, understanding we're not going to be able to answer all of your personal questions. Those you need to save for your personal physicians. Please keep in mind that Yodeah is not providing medical or insurance advice. This presentation is for educational and informational purposes only, and you should always seek the advice of your physician or other healthcare provider with questions you may have regarding your medical history, a personal medical condition, or treatment. Genetic testing is not a substitute for visits to your healthcare professional for treatment, screenings, or appropriate follow-up. The same holds true with respect to your insurance, as we will discuss later. So now it is my pleasure to introduce our panelists this evening, beginning with Dr. Liz Etkin-Kramer, who is the founder of Yodeah and a board-certified gynecologist practicing on Miami Beach for more than 25 years. She's also an assistant professor of OBGYN at FIU's Herbert Wertheim College of Medicine and is very active in the American College of Obstetricians and Gynecologists. Additionally, Dr. Etkin-Kramer has been appointed to the American College of Obstetrics and Gynecology Presidential Task Force on Knowledge Gaps in Breast and Ovarian Cancer Risk Assessment Management, including genetic testing. Dr. Elisa Krill-Jackson is a medical oncologist specializing in breast cancer at the University of Miami. She did her residency in internal medicine at Brigham and Women's Hospital and her fellowship in hematology and oncology at New England Medical Center and the University of Miami. She has been in practice in Miami for more than 20 years. Dr. Krill-Jackson believes in individualizing therapy for patients and compassionate care while offering cutting-edge clinical trials. Dr. Matthew Schlumbrecht is a professor in the Division of Gynecological Oncology at the Sylvester Comprehensive Cancer Center. He is the Vice Chair of Global and Community Health in the Department of Obstetrics, Gynecology, and Reproductive Sciences. He completed an OBGYN residency at the University of Texas Southwestern Medical Center in Dallas and a gynecological oncology fellowship at the University of Texas MD Anderson Cancer Center in Houston. Morgan Weinblatt is Director of Resource Development Engagement for Jewish Community Services. Morgan will share her personal story of what it means to be BRCA positive and the steps she took to mitigate her risk of developing cancer and passing it on to future generations. So with that, I'd like to turn it over to Dr. Etkin-Kramer.
Thanks, Sandy. Thank you, everyone who's here today. I'm just going to share my slides if possible. Share screen. I just need an okay to share screen. We're really good at OBGYN and cancer prevention. I'm not so good about IT. Thank you very much, Leah. So I wanted to give a little bit of a background. Can you see? I don't think you could see my. Can you see my screen now? Give me one quick second. One quick second. So let me give you a little bit of a background. We put together today's program to talk about the importance of knowing what's in your genes, as hereditary cancers are particularly prevalent in the Jewish community. 1 in 40 Ashkenazi Jewish, both men and women, carry a genetic mutation on a BRCA gene. Most don't have a family history, and most don't know that they carry this. And if, as a gynecologist, knowing if my patient carries a BRCA genetic mutation enables me to take care of my patients appropriately. And these genes have been around for the past 25 years. The first reports that showed that Jews were more likely to carry these mutations, if you were of Ashkenazi Jewish ancestry, the first reports were published 25 years ago. So this is not a new thought. But we did learn after that that the chance of an Ashkenazi Jew, either a man or a woman, carrying one of these BRCA mutations, as I said, is 1 in 40, which is 4 times more common than general population, which is basically of both Jewish and non-Jewish, non-Ashkenazi ancestry. Most Jews who carry these genetic mutations have no family history of cancer. If you carry a BRCA mutation, even without a family history of cancer, your chance of developing cancer is elevated. But, and this is the good part, there is a good part here, because we've known about these for 25 years, but if you know you carry this genetic mutation, there are established medical guidelines for risk reduction, such as medicines to decrease your risk of certain cancers, additional screening, such as mammograms, plus MRIs, and surgical procedures that currently are the mainstay of treatment and can markedly decrease the risk of cancer. And we have all of this data that shows this. A woman, for example, who carries a BRCA mutation, her risk of cancer of the breast can be upwards of 70%, her lifetime risk. And her risk of ovarian cancer for a woman who carries a BRCA mutation could be 40 or even 50%. And unfortunately, it's not only women, men who carry BRCA mutations can have an aggressive prostate cancer, a lifetime risk of about 30%. So it's important for men to know as well as male breast cancers. And it's also important because you can also can be associated with melanoma as well as pancreatic cancer. And the really exciting data has come out now that if you do carry a BRCA mutation and you have a family history of pancreatic cancer, they're able to do screening. And I know that's shocking because I grew up in the time when pancreatic cancer, there was no screening for, but they're able to do screening for pancreatic cancer that puts it at a surgically treatable stage, which is unbelievable, about 75 to 90% of the time. So knowing, having this information really helps us take care of you. Further, if you carry one of these genetic mutations, you can talk about preventing this mutation in your future generations. So men or women who carry this genetic mutation can undergo in vitro fertilization. Seeing a reproductive endocrinologist, which is a type of gynecologist that has additional fellowship and training, They can select out an embryo that's been fertilized that does not carry this genetic mutation. So we can end this in future generations. So in the future, we don't even have to have this conversation. We have partnered with a genomics lab. We don't have any financial interest with this genomics lab, but it's a commercially available genomics lab that allows us to do appropriate testing for $99. So it's quite cost effective. It is an excellent lab. There are a handful of very good labs. Color has offered it to us for $99 because they know how important it is to have this knowledge. So I'd like to now shift it over to my partners in crime here. Thank God that they're here. I get to be a moderator now, which is a lot nicer than giving you the information. I want to talk a little bit with Elisa Krill-Jackson, a friend of mine for uber amount of years, who's at University of Miami. Elisa specializes in breast oncology, and we share many patients together. So Elisa, let's talk a little bit about BRCA mutations in women in particular. We know that breast cancer screening exists in the general population. Let's talk about what we should do in women who carry a BRCA mutation. What screening is available?
So I think the most important part is to know if you're at risk for a BRCA mutation and get tested. As Liz has been crusading about. And I think it's important to do that in a timely fashion. So we definitely want patients, if possible, to be tested before age 25 so they know if they have a mutation, because we want to start screening for breast cancer by age 25. So for a patient who chooses to undergo screening for breast cancer who has a BRCA mutation, we recommend mammogram, even at age 25. So even though somebody's breasts may be dense, we want to do mammogram because you can see calcifications on mammogram, which you can't see in other modalities. We also want to do an MRI of the breast once a year. So an MRI is a much longer procedure, a much more difficult procedure than a mammogram, as opposed to lasting 5 to 10 minutes. It lasts about an hour. But it is very, very sensitive at picking up the earliest signs of breast cancer, which is certainly when we would want to detect them. And we recommend usually an MRI once a year, alternating at 6-month intervals with a mammogram.
And you said we want to know at 25 to 30 because these cancers develop in, normally we talk about breast cancer in a 40-year-old woman, but these cancers in the breast often start to develop in women who are in their 30s. Can you talk a little bit about that or any experiences you've had?
For sure. You know, we can see BRCA-associated breast cancers in women in their early and mid-20s. It's not uncommon. The rise really starts around age 25. So, you know, screening starting at age 25 is very, very important. I have many, many young women in my practice with breast cancer who are in their early to mid-20s. Many of these patients are, even if they're detected early, they end up having to have a lot of treatment, including chemotherapy, hormonal therapy, radiation, which, you know, when you're in your 20s can certainly make fertility decisions much more challenging and difficult. We see a lot of young women, and I think we're going to talk about this, but I think, you know, detecting this early or preventing it is really the way to go.
That's what we always say, that prevention for BRCA mutations is the key. If we can prevent a cancer, it's so much easier to prevent a cancer. So stick with that, guys and girls. Preventing cancers is so much easier than treating these type of cancers. Just briefly, Elisa, so we talk about the screening, and there are some medicines we can even use in BRCA2 positive patients. We talk about putting them on even medicines like tamoxifen to prevent breast cancer for a handful of years, about 5 years. What about surgical risk reduction?
So I'm very much in favor of surgical risk reduction. I think it is a big deal for patients, but having cancer is a much bigger deal. So we know that, if you have a BRCA mutation, you have a 70% lifetime risk of breast cancer. Those cancers can be spread out from your 20s to your 70s. So not everybody gets it at a young age, but we at this point can't tell who will get it at a young age. In somebody who's young and plans on childbearing, I think surgical prevention is actually quite important because, if you're going to get pregnant, that leaves a year and a half when you can't be screened most effectively for breast cancer. The other factor is that unfortunately BRCA associated breast cancers are often extremely aggressive cancers. They can sometimes grow between mammograms, between MRIs. So people can develop a cancer that is, not caught so early. Even if caught early, these cancers are often what we call triple negative or high risk aggressive, and they will require chemotherapy, which certainly can decrease somebody's fertility. Patients who may need chemotherapy may need to do expensive non-insurance reimbursed fertility preservation procedures if they want to have children. So as hard as it may be to consider a procedure like a bilateral mastectomy to prevent cancer, in many young women, that is the best way to treat this, is to prevent it that way. Mastectomies reduces the incidence of breast cancer in one's lifetime by 95%, not 100%, because there's always some cells left on the chest wall. But it is really quite rare to see a cancer develop in somebody who's had a preventative mastectomy.
So that's a really good point. We're back to the idea of prevention that can be life-saving, because again, we don't want to be treating given the choice. And there's a lot of data out there that I've read about the short-term anxiety that may be associated, because they're not easy procedures. This is not an easy conversation, but long-term satisfaction is fantastic. And maybe the articles don't use that word fantastic, but what I have seen in my practice is really quite remarkable. Matt, I'm going to turn the microphone over to you for a second. You're a GYN oncologist. Let's talk about prevention for ovarian cancer. But before we talk about it, because this is wearing my hat, prevention, how I'm going to keep you healthy, let's talk about screening for ovarian cancer.
Sure.
Throwing that one at you.
That's actually a very short discussion because there's no screening for ovarian cancer, which makes it quite a challenge. So ovarian cancer is not detected on a pap smear. It's not necessarily going to be detected when a woman goes in for her annual well-woman exam. And so unfortunately, the best that we can do for the general population is symptom awareness. So to have women be aware of things like bloating, increasing abdominal swelling, changes in your appetite, changes in your urinary or bowel habits, which may tip you off that there's an ovarian malignancy present. But unfortunately, the vast majority of women, because there's not a screening test, will present when they've got advanced stage 3 or 4 disease, which really underscores the need to engage in any sort of preventative measure we can.
So without screening, so in the average risk population, somebody walking around who doesn't have a family history, doesn't carry a genetic mutation, the risk of developing ovarian cancer during her lifetime is probably about 1.3%. People who carry BRCA mutations, it can go up to anywhere as low as 18%, 40, 50%, more or less. And again, back to the prevention aspect, in Ashkenazi Jews, BRCA is associated with 40% of ovarian cancers. So again, to me, this gives me information. If I know that you carry a BRCA mutation, I'm doing different things. What am I doing?
So this is a completely great opportunity to be empowered by this information because you can really control the narrative here. So in women with a BRCA mutation, typically we see the ovarian cancers arise a little bit later than the breast cancers. And so we start recommending further evaluation by your physician right around age 30. Typically what we will do is every 6 months, a pelvic ultrasound and a lab test called a CA-125. Now CA-125 is not a cancer marker specifically, it's more a marker of inflammation inside of your abdomen. So it's important to discuss that with your physician because a lot of other benign diseases can cause an elevated CA-125. But we will start that at age 30 And then depending on the specific mutation the woman carries, we'll have a discussion about risk-reducing surgery. And in this case, salpingo-oophorectomy, or removal of the fallopian tubes and ovaries, is going to be the recommended procedure. And we know that when we do that, we reduce the risk of ovarian or fallopian tube cancer by well over 90%.
So something that is usually diagnosed at stage 3, we're decreasing that risk, a risk of a very difficult, painful cancer to markedly less, from the 18% to the 50% down by 90 some odd percent. Would you put them on birth control pills?
I absolutely would put them on birth control pills. So we've got really great epidemiologic evidence from large population-based studies that shows that for a prolonged amount of time on birth control pills, you can actually cut your ovarian cancer risk by up to half. And so when we're talking about chemo prevention, much like tamoxifen with the breast cancer patients, having somebody use birth control for contraception can actually be of substantial benefit. And there's not kind of a lifetime cap on how much birth control that you can use. So actually, the longer one uses birth control, the greater the benefit.
Wonderful.
Absolutely.
So there is a little bit in the sense of chemo prevention.
Mm-hmm.
So we talk about surgical risk reduction to decrease our risk of ovarian cancer. We're wearing our prevention hats. Are there any new developments in terms of studies that are being done so we don't put these women into menopause given the choice?
No, absolutely. And I think that's a great point, because when we're talking about risk-reducing surgeries, the current guidelines are to start having that discussion as early as 35 years of age. And for comparison, in the United States, the average age of menopause is 51. So we may be putting women into menopause, actually we are putting women into menopause well before they would otherwise naturally be going into menopause. And we know that that increases the risk not just for very symptomatic menopause in terms of hot flashes, headaches, insomnia, things like that, but also accelerated bone loss, osteoporosis, cardiovascular disease, and mental health changes as they age. So when we talk about BRCA-associated ovarian cancer, it's a little bit of a misnomer, because we actually know that most of them arise from the fallopian tube. And so there's a current study that was started by the NRG, the National Research Group, in which we have open at Sylvester, called the SOROC trial, wherein women who've got a BRCA1 mutation specifically between the ages of 35 and 50 can be offered a salpingectomy only. So what that means is we just remove the fallopian tubes and then leave the ovaries in until a later time, at which point the patient and her physician decide to remove the ovaries. And the underlying theory is really that we're going to prevent the abrupt change of surgical menopause, allow several additional years of estrogen exposure, and hopefully reduce some of the secondary effects that we see when we take people's ovaries out very early. What's great about this study is we're kind of looking at outcomes. We're also following quality of life for a very long time. And we suspect that quality of life suffers markedly when we take somebody's ovaries out at a very young age. But the hope is also that this is going to provide some guidelines for how we should be screening women who do undergo ovarian removal in the future.
That's exciting. So, but to be clear, this is the SOROC study is part of a study. I'm hoping that nobody takes away from this saying, okay, let me go have your gynecologist do risk reduction salpingectomy. But you want to do it as part of the clinical study because you want to be followed appropriately. And I would add too that when in patients that I do risk reduction bilateral oophorectomy salpingectomies on, we will put them on hormone replacement, and I make a terrible joke. I say, this is so you're not going to hate me, but it's also because they're miserable.
Sure.
Surgical risk reduction is tough, but it's also to help their bones, their heart, and all the things, the secondary things. But I think it's an exciting thing that we're looking at different things to do besides what we've done that has been quite successful for so many years.
But it also goes hand in hand with the breast cancer prevention.
Right.
For sure.
Because if somebody has developed a breast cancer, then we do not think it's safe for them to have hormonal therapy afterwards.
Correct.
So again, preventing the breast cancer gives you so many more options in the future.
Correct.
For keeping ovarian function and estrogen in your body.
Absolutely.
So it's a dual approach, if not more. It's looking at the whole picture. And you were saying that we take out the current standard of care is removing the tubes and the ovaries. So, and it's at a relatively young age, so we're shortening the fertility. Let's talk about what the options are for that type of patient. Fertility options in terms of trying to allow them to have children, to reproduce, to do all that.
Sure. So, I mean, I think it's a great question, and everybody who's considering risk reduction should have a discussion with an infertility specialist because there are multiple options. I know we were talking about earlier about, egg retrieval and kind of selecting embryos that don't have BRCA mutations. The younger that a woman is, the greater egg reserve she's got in her ovaries and the higher quality of the egg. And so kind of early discussions are really important. But in the event that a woman has her fallopian tubes and ovaries removed and her uterus is still intact, she can still carry children. They'll be supported and everything with hormones by the infertility specialist, but you can actually carry a baby to term even without fallopian tubes and ovaries. And by really considering pre-planning, having egg retrieval and embryos, you can actually have your biologic children after you've had your fallopian tubes and ovaries removed with assisted reproductive technology.
Pretty cool.
Yeah.
It's really cool. We started the conversation talking about how important it is to get tested. So in general population, we base testing on family history or personal history. And in this sphere, we're talking about ancestry being an important portion of the reason to get tested, because as we said at the beginning, Ashkenazi Jewish, they don't have to have a family history to still have an elevated risk of carrying a BRCA mutation and having the associated consequences of a BRCA mutation. What do you say to your patients? Because sometimes when I start to go there, some of the patients kind of say, stop, I don't want to talk about it.
Yeah.
How do you encourage your patients to have testing?
So, I mean, I think the empowerment and knowledge is so important. My practice is caring for women who present very often with advanced stage ovarian cancer. And even in early stage ovarian cancer, chemotherapy is almost always indicated. And that's a tough road to follow. And unfortunately, even with the best treatments, the vast majority of women with ovarian cancer will have some sort of recurrence. And in the setting of a BRCA mutation, we're not talking about one type of cancer, we're talking about multiple types of cancer. So really kind of pre-planning is important. But the thing is, it's not just about you, because when you test, you know what your history is, but we talk often about what's called cascade testing. So when you find out that you've got a diagnosis of one of these deleterious mutations, the inheritance pattern is 50%. So half of the people around you are going to have this mutation potentially. So this is a great way to let your brothers and sisters, your parents, your children, your cousins, get those people tested. If they test positive, get their children and their relatives tested. And really, from a population screening perspective, this is the best way that we're going to make a dent in ovarian cancer. So you're going to really kind of impact your own health, but also the health of your family too.
That's a great point. From a population-based perspective, this is the best thing we have to identify who's at risk for ovarian cancer. It's not perfect, but it's the best we got until we can figure out screening. Elisa, will you talk, I know you're a breast cancer oncologist, will you talk about the impact of BRCA on men? And remember, it's 50-50. This is not on only women. The cancers are more common in women, but I often see patients whose family history on their mother's side has breast cancer, the mom's negative, and the dad carries it.
Well, certainly half of our BRCA carriers are men, and they are at risk for significant numbers of cancers, especially men with BRCA2 mutations. So we know men with BRCA2 mutations have a significant risk of early prostate cancer, up to 30%, which can be aggressive prostate cancer and often starts earlier than most men would undergo screening for prostate cancer. So in somebody with a BRCA mutation, you'd want to start screening for prostate cancer in the 30s as opposed to 40s and 50s. So men getting tested can make a huge impact on their health. They're also at risk for pancreatic cancer and melanoma, and certainly now we have some evidence that we can screen for pancreatic cancer. But men also get breast cancer. Now, the vast majority of men with BRCA mutations will still not get breast cancer, but breast cancer in men is very similar to breast cancer in women. It tends to be estrogen sensitive. It tends to be because we don't do mammograms on men routinely. It tends to be found because somebody feels a nodule in their breasts. And many men will ignore that for a time. And so breast cancers in men can often be diagnosed at a very late stage because it has been ignored or put off. So although it's a small number of men with BRCA mutations who get breast cancer, it's important to know, and I certainly have a number of men in my practice, and we treat them just like we treat women. They have surgery, they have chemotherapy, they may need radiation, they get anti-estrogen therapy.
Fantastic, thank you. I know I kind of threw that one at you as a female.
What I do.
We're talking about female, that's right, that's exactly what we do. So again, we're all about prevention. We're all about having this conversation. We want to share this. Thanksgiving is going to come up. You want to share either family history. If somebody carries a mutation, please don't silo it, because you need to share that with your family, because otherwise people are going to be diagnosed with cancer that could have been prevented. If it's since we have a few minutes, I definitely want to talk to Morgan. Morgan Weinblatt is an amazing person, and I'm so thankful she's here to talk about her journey. Morgan.
Thank you. So good evening, everyone. My name is Morgan Weinblatt. I didn't think of my experience as a story, but here we are. I am the daughter of a breast cancer survivor. So my mother had breast cancer at a very young age, and she was BRCA negative. She was tested for the BRCA gene. She was negative. And my whole life, I grew up being proactive, going to get mammograms from the time I was 26 years old. And it wasn't until right before the pandemic, February 2020, when my family actually got a Facebook message from a cousin in New York who reached out and said, you know, I got tested for the BRCA gene. I am positive. I think you should all get tested. This was on my father's side. And we were completely shocked. We had thought we had done all the right things, you know, doing our mammograms, our MRIs, being very cautious. So this was just a very shocking message to receive. So I went to Dr. Etkin-Kramer. I told her the news. She had been in the know about my family history. Not only did my mother have breast cancer, my maternal grandmother as well.
Did we talk about testing before? I don't remember. HIPAA, I know, I can't talk about.
We did not, because we didn't know about my father at the time.
But we would have talked about family history. We wouldn't have talked about family history. We would have said, oh, you're Ashkenazi Jewish. Usually between 25 and 30, I have that. So.
We did, but I was still doing my mammograms and my MRIs.
Okay, because of your mom.
Because of my mom. And then the kicker was that we learned about this
Right.
family member,
Right.
the cousin.
On the,
So,
on the other side.
on my father's side. So once my father was tested and found out that he had the BRCA mutation, we immediately were all tested, myself, my sister, and we have the BRCA mutation. This was right before my wedding in March of 2020. A pending, looming pandemic was coming, and it was just such a chaotic time. And, we got married, we had our wedding, we were in the pandemic, both working from home. Things were sort of unknown. And 6 months later, I reached out to Dr. Etkin-Kramer and said, I really want to talk about my options, because we're in this pandemic and I just need to know what I can do. Coming from that prevention mindset and doing what I can to mitigate my risk was really important. So we had talked about a prophylactic double mastectomy, and that was the decision. I knew that I had to do that. I knew that I had to have the surgery. It was really not an option. I thought about it for probably a week, and we went and met with doctors, and I scheduled the surgery for right after I turned 30 years old. And I had the surgery. I had my reconstructive surgery a few
Your
months
breast
later.
surgery, right? Yeah.
Breast surgery, exactly. And
How'd you
recovered. I went on my honeymoon. You know, I felt really good. I felt
Good.
really empowered, and I felt a sigh of relief. I really, you know, felt like I was doing what I needed to do.
You took ownership. You said, I'm gonna, this is impactful.
I
You
did.
took ownership. Good for you.
I did. And, you know, my husband and I, we did make the decision that we wanted to look into, you know, in vitro fertilization to try to remove the gene. And we are going through that process now. And, you know, now looking back on everything, it's a year later. I just passed my year of having my reconstructive surgery. And it really was the best decision I ever made, because I really have so much just relief. And I have such a sense of, I can live my life in peace. I know that I did the right thing. I'm leading just a healthier life. And, you know, hearing you talk, I know that I have a continued journey, because I'm 31. So I've spoken about, you know, with doctors when I'm 35 years old, you know, what that looks like in terms of prevention. But I think, you know, the message tonight is really learning what you have, testing, and having that knowledge and being able to make a decision for yourself. Because truly, when you don't know if you have something, if you're in the dark about your health, then you're further down the line of higher risk, and, you know, it's very hard to treat. So that's been my biggest message. And I hope for anyone that's listening and watching, whatever age you are, test, but also share that with family, because it is 50%. And, you know, there could be a brother, a sister, a parent, a child, a cousin in your life that is impacted. And so that's, I think, the most important thing to take away from this evening's program.
Amazing.
Morgan, you are so remarkable in so many ways. And one of the gifts that I've received from working with Yodeah is getting to know you. And you are so strong and so brave, and you are saving lives by sharing your story. And I think that one of the remarkable things is, you know, the assumption was it came from your mother because your mom had breast cancer.
Yes.
And to find out through a random Facebook message from a distant cousin that it actually was on your father's side. It is such a powerful takeaway from all of us in terms of both testing and sharing the knowledge. So thank you. It's not easy to share your story, and you're so brave. The message tonight is to get tested. It's such an easy way to do it. We're going to show you, we're going to put up on the one hand our QR code so that you can go to our website and order your test. But I also want to show you, Liz is going to demonstrate, it is a simple saliva test.
Saliva has a bad name now because of COVID, so I'm not going to actually give a sample. But you spit into this.
In the privacy of
In
your
the,
own home.
or
In the privacy of your
we're not fancy, you can go behind a chair, it doesn't make a difference. The important thing is that you get tested, you get this knowledge. It's so impactful. We don't get the results at Yodeah. We don't get anybody's individual results. We will get results in aggregate because we're getting grants based upon how well we convey our message. This is guideline to get tested. This is guideline. And we can do the test. It's inexpensive. It's $99 through our website. Sandy, I feel a little bit like like an infomercial.
Vanna White here.
A little infomercial, but you get the idea.
So we have our QR code on the screen. That will take you to the testing page on our website. When you go on, order your test, put in the code NO30. We are now able to get that test for $99, which is quite remarkable. I know when I first wanted to do it years ago, it was $5,000 and it wasn't covered by insurance. But thanks to the fact that the patent ran out and our relationship with Color, we are now able to get it, like I said, for $99. In addition to which, if anyone in your family, regardless of where they tests positive, Color will supply a test for the rest of the family for $50 each. So finances should not be the gating factor for, it's very accessible. So while you're there ordering a kit, order one for someone you love, order one for everyone you love, because really this is about saving a life, is about prevention. It's about knowing what's in your genes. I also want to point out that with this test, they test for a total of 30 different genetic mutations, all of which are actionable. So if you were to find that you have a risk of a certain genetic mutation, there are steps that can be taken to mitigate your risk. So it's not like some tests where you go, oh no, I have this and now what? There are steps that you can take to reduce your chance of getting cancer. So please, I beg of you, go online, order your test. Whether you do it through our website or you do it through your physician or you do it through a genetic counselor, we don't actually care where you do it. We just want you to have this information. The other thing that I need to talk to you about, and I have to read this a little bit because, I have to make sure I get the language right, which is that there are insurance questions that come up with respect to genetic testing. Will this impact my health insurance, my life insurance? How does that work? So this is the part I have to read. In 2008, the Federal Genetic Information Non-Discrimination Act, also known as GINA, although not named after our board member, but it could be, it became law, which generally forbids health insurers from using genetic test results for decisions regarding rates or coverage. There's also added protection under the Affordable Care Act and state law. However, GINA does not cover life, disability, or long-term care insurance. These types of insurance are regulated by state law. Fortunately, for those of us who are living in Florida, Florida enacted a law that states that in the absence of a diagnosis of a condition related to genetic information, life and long-term care insurers may not cancel, limit, or deny coverage or establish differentials in premium rates based on such information. If you go to our website, you will find additional information about this. And if you have any concerns, we actually suggest that either you have your insurance in place or you have your parents tested so that you're not putting any of that at risk. Because if you know that either or both of your parents carry the mutation, then you have a 50% chance of carrying it. But if neither of your parents carry this mutation, then you have less than a 1% chance of being BRCA positive. So if there's a question about your insurance, if your parents are alive, then start with your parents and work your way that way. So now what we want to do is open it up for some questions. And the first question I have that I will turn over to our panel and is, I'm in my mid-60s or 70s. Does it make sense for me to test? Do I need to know?
Absolutely. The actual risk of breast cancer and ovarian cancer related to a BRCA mutation goes up with age. So in somebody in their 60s, we may not necessarily recommend a prophylactic mastectomy. We may use medications to prevent cancer. We may use more frequent screening, but we would definitely recommend a salpingo-oophorectomy to prevent ovarian cancer. So it absolutely, if you're in good health, it is very important to get tested. Plus, as Matt said about the cascade testing, it is the best gift you could give to the rest of your family if you find out, because other members can get tested and can prevent cancer.
So, and we've talked a little bit about this, but I want to stress it again. And the question is, because we hear this a lot, if I'm BRCA positive, am I automatically giving this to my kids?
No, it's a 50-50, kind of like a coin toss. So half of your ova will be BRCA negative and half will be BRCA positive. So it is a coin toss.
Thank you.
And it doesn't mean if you carry a BRCA mutation that you're going to develop cancer. It just means your risks are elevated. And again, I'm wearing my prevention hat. How do I prevent cancer? This is a means of preventing ovarian cancer. I want to put him, and her too, but him in particular, out of business. I want to put that out of business. GYN oncologist. We don't have screening. This is a way of mitigating our risk of ovarian cancer.
Or for men too.
Yes, for
Right.
men
It's
too.
not just women,
Absolutely.
Sorry, I didn't mean to suggest.
right? We gotta just put cancer out of
For sure.
How can I keep you healthy? My hat.
Right. Okay. So one of the questions that's come up for us is if I order my test through the website and I go through color, Dr. Etkin-Kramer, are you going to get the results and are you going to call me and tell me what I'm supposed to do?
So again, because of HIPAA laws, which is a law that prevents people getting your medical information or genetic information without your signature and without you okaying it, we do not get your results. You can share your results. You can send us a question. We answer questions. But you get your results directly through color, and they have genetic counselors to talk to you. So a lot of the questions that are answered, now we have a before you test page, which addresses many, if not most of the questions you're going to have before you get tested. But the after testing, the information is available through a genetic counselor. And anybody can send me an email. We do not get your results.
You know, you're very gracious in saying anyone can send you an email and ask you questions, but now I have to be a little protective of you and say, especially like when I read the questions that came in the chat,
Yeah.
we cannot provide, you
You're
cannot
right.
be in a position
All right.
to answer
True.
questions that are personal in nature or
You're right.
impact somebody's, specific questions. So the questions that you
Good
can
point.
answer are more
Are
general.
general. Good point. Good point. Would I recommend removing tubes and ovaries in a 50-year-old who's BRCA positive? Yes. Yes. Surgery? Yes.
Right.
Forgive me, I didn't mean to.
Sorry, I
That's
just
okay.
have to protect you.
It's okay. It's okay.
Protect you and manage expectations because
Yes.
I don't want to get your inbox flooded with, well, and the bottom line that we want to really stress today is that we want you to get tested. And we don't really, again, we don't care how or where you do get tested. The other thing I want to mention is that while you're online ordering your test, we'd love for you to consider a donation to Yodeah. We are 100% volunteer run, organized, staffed, we schlep, we do whatever it takes to get done. And in addition to being 100% tax deductible, your contribution helps us educate more people, reach out to more people, provide information, and continue to provide access to testing at a cost-effective rate. So we're going to put up another QR code that shows the link to our donation page. So again, we would love for you to do that, to go online and make that contribution if at all possible. Jewish tradition teaches us Mishaneh Makom, Mishaneh Mazal. By changing our place in life, we can change our fortune. And we've also always heard the expression that if we save one life, it's as if we save the entire world. Through our work with Yodeah and through you all acting as our advocates and sharing this information with your friends, with your family, you can help us save lives. That's what we're all about. That's what we're doing tonight. And so we want to thank you for joining us. We want to thank our partners who have graciously helped communicate our message and send out our emails and who have been supportive of us, because we are all in this together. Our goal is to save as many lives as possible. So we want to thank our panel and all of our participants tonight. And again, please get tested, share the information. Knowledge is power, and knowledge saves lives. So thank you very much for joining us. If you have any additional questions, feel free to email us. If they're general, we will answer you. You can go to our website, www.yodeah.org, to get more information. You can get information about testing there, and you can reach us at info@yodeah.org. So thank you very much for being a part of our evening and spending time with us, and get tested. Thanks. Have a great night.
Are we doing any other questions or we?